in this video I'm going to dive into the supine to long sit test that typically assess for a leg length discrepancy or SI joint dysfunction. And what we're looking at in this test is the movement, the relative motion of anterior and posterior position of the ilium. And so that's anterior and posterior tilt is what that's called. And I encourage you, as we're doing these movements, to try these, stand up and try them. What we're really looking at is how well the relationship of the muscles on the front side of the hip and the low back work with the muscles on the back. So if you are in an anterior tilt, that means the ASISs drop down and the PSISs drop up. Do that here right now. As that happens, you can feel how the low back goes into more of a compressed position, and that pulls tension on the hamstring. So the hamstrings take on more tension or they take on more stretch. At the same time, the hip flexors, the hip goes into a flexed position with an anterior tilt, and that shortens or puts a tightness into the anterior hips. That often will limit then the ability to move through the pelvis that way. So let's say someone is locked in an anterior tilt, which like oftentimes we see individuals who are anterior tilted and their knees collapse in a little bit because that's the natural sequencing of the body. So let's assume that we're in that anterior tilt to start. The hamstrings are on more tension, and then if I go to deadlift from there, the hamstrings are preloaded essentially because you're starting in an anterior tilt and then trying to maintain tension or strength across the whole backside of the body there. What we want is a balance or equilibrium, a length-tension relationship between these muscles and these muscles. So too much back, like so if out here I'm in a posterior tilt, my ASIS is up and my PSIS is back, that's gonna create, like if I'm starting here, it's gonna be hard to get that position as well. It's the best if we can load through a neutral spine because that allows for the best biomechanics and it takes the least strain onto the tissues. So what we want is that balance. Now when we're doing the long sit test, there's a few complications with this. So the person's lying down, you check their medial malleolar position, and then as they sit up, if we see a change or a difference in the position, that tells you sort of if it's an anterior or posterior innominate. What happens is when you sit up, similar to standing, when you sit up or when you're up tall or you're going to an anterior tilt, it's going to put tension on the hamstrings. So if you sit in a long sitting position right now, sit up real tall and you'll see how your knees want to bend, and that's because you're putting a big stretch on the hamstrings. What that big stretch on the hamstrings does is it pulls the pelvis into an anterior tilt relatively, or it will on one side, and because of that, then it's going to tell you that you're starting in a relative posteriorly tilted position. So it goes from posterior to anterior. But what I want you to think about is when someone does that test, they're supposed to sit up on their own. So let's say they're here and they sit up on their own, but they don't want to load their hamstrings or it hurts their back, so they sort of sit up like this. Well, here is a lot different than sitting up tall through the spine, which is going to really change the length-tension relationship of the hamstrings more.